Hey guys, it's Dr. Akiva Green here. I just want to talk to you guys about some really important questions that I deal with probably every single day in our clinic. And that's the concept of how we can help a patient who is on their cancer journey. So my name is Dr. Akiva Green. My clinic is Lake Norman Integrative Wellness. I am fellowship trained in integrative cancer therapy, fellowship in 2015 from South Florida Medical School. I am a doctor of natural medicine, and we have a full medical team on staff with us to help patients in their integrative cancer journey. So a lot of patients come and they're worried about a diagnosis. They're scared, they are confused, they're being pushed into a path very quickly, and they're not sure if it's the right path for them. A lot of these patients don't know if they want to continue and start chemotherapy. They don't know if they want to go the traditional medical approach. And, they come to me and say, hey, do I have to do this? What options do I have? And I'm not here to say don't go the medical route. I'm here to give them the information they need and to help their body in as much an approach as we can to give them better outcomes. For some of our patients, that means chemotherapy may be the right solution, but there's a question that's never asked or answered by the oncologist, and that's, how did this cancer start? How do we develop this? And how do I make sure that if I do this treatment, it's going to stay gone and not come back? So we're able to help come in and say, hey, let's give you better outcomes. A lot of what we do isn't just about killing cancer. That's the traditional medical approach. It's what they do. It's about, I often say, play whack-a-mole with the cancer cells, because they're going to kill it and they're going to hope that it stays gone. But they ignore the terrain. They ignore the environment that's there that allows that cancer to grow in the first place. So we practice functional medicine in our clinic, and we have a number of tools that we use that allow us to help make sure that you have the best outcomes in your cancer journey. A lot of our patients are looking for an integrative approach. They think they want to go traditional route, but they also want to do everything they can beyond that to make sure they have the best outcomes. Some of our patients have come to us who have already failed in the medical route, and they're looking for other options that they didn't try before. Some of our patients don't want to go that route at all, and we're here to provide the best guidance we can for what their options are that exist. A lot of the testing that we do starts with tests that aren't traditionally used in the American cancer system. We have access to testing out of Europe that allows us to actually test for efficacy in your cancer cells. It is a blood test against the majority of chemotherapy agents that are used, the majority of immune therapy agents that are used, and a significant number of other medications that may be used in a cancer fight. It also allows me to test for cancer efficacy, cancer treatment efficacy against over 50 natural substances that have been shown to potentially help fight cancer or support your body in the fight against cancer. So the testing helps give us guidelines. It gives us a basis that we can then turn around and say, hey, these treatment options are going to be the right options for you. It allows us to come back and say, we can use this treatment from your oncologist or work with the oncologist that we work with. Or, you know what? Here's the research in the PubMed literature that shows that that treatment has side effects and or may not have the best outcomes for you individually. And here is the European testing that allows us to know which ones may be better, so we can coordinate with your oncologist to make sure you get the best chances. The best tools are used. We have other treatments that we use in the clinic. We use IV therapy, IV ozone, as well as high dose vitamin C or ascorbic acid, as well as alpha lipoic acid and a number of other IVs that help to support your body in the fight against cancer. And you get a very high percentage of absorption, up to 100% absorption when you use an IV vitamin versus a oral. And our medical team runs the IV department and does a great job of making sure that patients get the care that they need. We also utilize tools like pulse electromagnetic field therapy, radio frequency therapy, something called a RIFE, as well as biocharger, and neurofeedback is utilized for patients who have brain fog, focus, memory, or concentration issues, or anxiety, depression, or headaches, or sleep problems. So we've got a number of tools that we use to help our patients improve their health. The whole goal is to make sure that we can give you the best outcome possible. And what we really do is we're here as a second opinion. So it's about finding what options exist beyond the traditional approach or in conjunction with the traditional approach. There's something called resistance. Resistance is how the cancer cell finds a way to beat the treatment that's being done. We want to determine if there's resistance against those treatments and give you better outcomes to lower that resistance. There are terms that are utilized that allow us to determine how long a treatment's going to work and what the expectation is before cancer comes back. Those terms are in the literature. We can look up those statistics and say, hey, this treatment is the right option for you, or we may want to look at this other option if we're seeing an option that isn't maybe the best or has significant side effects based on the benefits that are there. Everything that we do starts with a consultation in the clinic. We call it our second opinion consultation. You just have to reach out. Our contact info is going to be above or below this video, and reach out to us. We'll get you scheduled in with me, and we'll be able to sit down and do a consultation and figure out what treatment options are best for you individually. If you have any questions, feel free to DM or send us a message, or just call the office and we'll get scheduled, and I look forward to helping you.